Dr. Paul here. I am retired. I don't diagnose or treat, but we've got an opportunity today. Thank you for being willing to share. Mom who's about 2 weeks out from delivery date, who has had type 1 diabetes, right?
Yeah, my whole life, since I was 18 months old.
Wow. When you have diabetes, you think of having high blood sugars. And when it's type 1, you've had this your whole life, your pancreas at 18 months, it sounds like, shut off.
Pretty much.
And we know that now to be an autoimmune thing. Mm-hmm. So your own immune system sees your pancreas as an invader. Your immune system got confused, and your islets of Langerhans in your pancreas could no longer make insulin. If you can't make insulin, insulin's what takes blood sugar and says, you're supposed to be right here around 100. And so if you have too much, we just shunt it to the cells, store it as fat. There's a whole process. If you don't have enough insulin, your blood sugars just rise. Yep. And if it gets really too high, you start peeing all the time, trying to pee off the sugar.
Yep.
You get hungry because you're losing all your sugar, so you're eating all the time. And then pretty soon, if you can't control it, you're in a coma. And so sometimes, especially little babies, will end up in the hospital in a coma.
Yep.
Is that what happened?
I wasn't quite coma yet, but they told my mother that if she hadn't gotten me to the hospital when she did, it would have been...
You were getting there.
I was getting there.
Yeah. When I was an active pediatrician, I diagnosed several cases, and they almost always have that same classic story. So then, in your case, type 1 diabetes, you are given insulin. You've been taking insulin your whole life.
Yep.
And I have a brother who's done it since he was 20. It's, shots, right? You give yourself shots of insulin.
Kind of.
Now they have a pump.
Yeah.
The pump has made it easier, which is nice. You can control your blood sugars better.
24/7. It's a constant insulin drip.
And you have it's on your phone, right, with an app?
No, actually, it's a little monitor.
Oh, okay. And so you can read on that monitor where your sugars are at?
Yep.
So it's 133 right now?
Yep.
Perfect.
If you want to take a look at that, you're more than welcome to.
And you can probably see what your average has been?
Yep, I can go through, I can change the settings, I can change if I need a different bolus, if I need more insulin, less insulin at certain times.
Yeah. And how has your blood sugar control been the last couple months?
Well, the last few months have been a little harder just because there's a lot going on in the body. So you're kind of looking more at the higher ranges.
Yeah. And that's necessary when you're pregnant. You don't want to bottom out.
Yep.
Right? And that's the danger of diabetes is if somehow you bottom out.
Yeah.
Because then you pass out, you're in a coma, and if nobody addresses that,
then it's over. We had that problem a lot in the first trimester.
Interesting.
There must have been 2 times that I was that close to a coma.
Wow.
And both times...
From low sugars.
Yeah. And both times they were caught, thankfully, but your body starts to shut down, you start seizing, it's not great.
Yeah.
And not only does that, of course, affect you, but it affects the baby. So you really got to pay attention to that.
So how's it affecting the baby?
Well, if the baby doesn't have enough blood sugar to sustain life, you need a certain amount of blood sugar.
So she's maintaining blood sugar for herself and
the baby.
Yep.
So what they ask you to do, and rightly so, just based on that example of what happened to you, is in pregnancy you keep the sugars a little higher, just to have that margin of safety.
Yep.
So you don't have to come to the rescue. Like my wife just passed out. What do I do? Mm-hmm. And there are things you've been trained to do, probably glucagon, and if you can get if they're able to take sugar or So
that's awesome.
When you keep those sugars a little higher than you would normally want them, that unborn child is experiencing those sugars.
Yep.
So they, in their pancreas, which is now starting to be functional, they're making more insulin because they're seeing higher sugars.
Yep.
So their pancreas ratchets up, and it's like, we got this, we're making insulin, we're going to keep our blood sugar. Well, at birth, you get disconnected, and their insulin levels, because they're used to seeing higher sugars, are high.
Yep.
And almost immediately within hours, those babies crash because they're not eating yet. They just got born. Their supply of nutrition was through the umbilical cord. Mm-hmm. Disconnected, they lose their sugar supply, their nutrients, and they crash. So this is why, the main reason it's high risk. And sometimes we can get that sugar managed with just rapid feeding, and they're either going to use donor breast milk, hopefully, or formula. Mm-hmm. But they have to support the baby so they don't crash and bottom out. The other thing that's worth being aware of, and I'm sure this is partly why your OBGYNs have probably been recommending either inducing you or scheduling a C-section soon, is that when you're exposed to higher sugar levels in the womb, that's more nutrition, and the babies get bigger.
Yep.
So babies of diabetic moms, whether it's insulin dependent or gestational, are bigger babies. And just by physics, getting a bigger baby out's harder.
Not great, yeah.
More likely to have a C-section. So those are kind of the two big issues. Yep.
That was a good explanation. So what's the
Thank you.
difference between, so for me, I was tested for gestational diabetes quite a bit, and that, again, you're tiny compared to what I was.
Well, thank you.
So I'm like, wait a second.
You've done a really good job.
I know. It's like, what is going on? Why is he so big? So what's the difference in gestational diabetes and diabetes 1 or 2?
Yeah. Well, diabetes type 1 is what you have had most of your life, and that's that pancreas has shut off permanently due to autoimmune reasons.
Okay.
Whether it's type 2 diabetes, which a lot of people have or are in the process of becoming type 2 diabetic, it's generally related to obesity and being overweight and stressing the pancreas to the point where you develop something called insulin resistance. And so you have to make more and more insulin just to keep your blood sugars even. That's the non-pregnant type 2 diabetes. Gestational diabetes is the type 2 really of being pregnant. You're putting more demand as you got pregnant and you're gaining weight appropriately so for that baby. You're putting more stress on your pancreas. And the same sort of phenomenon happens. You have to make more and more insulin. And you have the same issue at disconnect time. That baby was used to seeing more insulin, and all of a sudden more glucose, so they had a higher insulin. All of a sudden, bam, they don't have any food, and their high insulin causes their blood sugars to bottom out.
Okay. So have you experienced anything? What can you share with people out there of where you're at? Because you're going through this, which I will share, in a much more holistic way than a lot do. You've got support at home, you're eating organic, you're staying hydrated, all those things. That I don't always see that. I've worked with 2 other women that were diabetic 1, and I wasn't even involved until close to the end just because they were so overly kept under the doctor's thumb.
Right.
And told what to do and how to do it, and they were super fearful. I don't see that in you.
Yeah, that honestly has a lot to do with the support group. I first trimester was 100% doctors. I have no idea what's going on. This is my first pregnancy. I'm a diabetic. What the heck? But through my husband here and his family, who are really more into the holistic stuff, they made me realize that there's just some stuff that you just don't want, and that's okay to say. It's okay to be like, hey, I don't want to be induced. And the organic stuff, you can tell a difference. At first trimester, I wasn't eating organic, I wasn't drinking a lot of water, I wasn't doing anything that I probably should have been doing, in all honesty. And the switch over, you just feel better, you look better. I mean, you guys keep telling me I'm tiny, so I'll take it.
You don't feel that way.
I definitely don't feel that way. I feel like a backwards turtle. But it just has a lot more benefits. You feel better, you look better, and you feel happier, I guess, knowing that you're going to have a healthy baby and it'll all be okay, even though you're a diabetic.
Right.
Yeah. You're doing everything you can.
Yeah.
So good
You
job.
are, and that's all
Good
you can
job.
do, and you're making great and healthy choices for baby even after. I think that's part of it, is being prepared and knowing is going to make mamas feel safer.
Yeah.
A lot don't. They feel like, I've got to listen to the doctors, I have to, and I am not saying not to listen to your doctors.
Yeah, no, definitely.
Medicine has a place, but childbirth should be natural. You don't get the option of staying at home and having a baby. There's too much risk.
Yeah.
But I think there's a lot that we can do, which is where...
I mean, absolutely, and we're built to do this.
Right.
Like, females are built to have children, so it's a natural thing that your body does.
Yeah.
The diabetes just adds a extra layer.
A little twist.
layer of complication.
Layer.
So I believe you're going to go into pregnancy support and labor support.
Labor
really.
support. Why do you think that's important?
Well, here's the thing, folks. If you look at the statistics for how many first-time moms end up in a C-section, it's about 33%, 1/3. If you have a uncomplicated pregnancy, we're going to call yours slightly complicated just because of the diabetes and the possibility of a larger baby mostly, and that blood sugar issue. But if you have an uncomplicated pregnancy and you were to have a home birth, and we're not saying you should have a home birth, but the rate of C-sections for those mamas is 5%. In other words, 95% of home births for first-time moms end up with a perfect outcome, no problem. 5% end up going to the hospital, like for various reasons, right? That's a huge difference, 33% compared to 5%. And there's a host of benefits that come from delivering vaginally. Mm-hmm. The babies have to go through that journey that does a lot of important things for them. They get exposed to all the vaginal bacteria that are actually good for the baby's immune system. Mm-hmm. It just sort of seeds that initial, here you are, you're part of mom and baby. This is how you're supposed to be exposed, not the organisms that are in the hospital.
Yeah.
Right? So lots of advantages to vaginal beyond even that. So it's good for the immune system, it's good for the lung development, just being squeezed out has benefits, and I'm sure you can add others, but it's really worth going for, right? If at all possible.
Yeah.
So if you don't have support in the hospital, doctors being doctors and hospital systems being what they are, they have these long lists of protocols that are designed to make sure everything's going to be okay, is what you're told. But it's also, that is true. They're trying to make sure outcomes turn out best, but they're also trying to avoid any kind of possible liability. Right. So it's really, protocols are designed more for that reason than for having a vaginal birth. And there are even economic reasons. If I'm a doctor and I'm taking care of you, and I'm not saying your doctors respond this way, but the system is the system. If I do a C-section, it happens quickly on my timeline. I schedule it and I get paid a lot. If I help you with a vaginal birth, it takes forever and I get paid very little.
Yeah.
So the economics of it just makes sense. Let's just get that baby out. Plus you're high risk anyway, right? So
yeah.
And that's where it takes being proactive, which is what you all are doing, to do. If it ends up a C-section because it has to be that way, so be it. But it won't be because you didn't give your best shot to reduce the likelihood of that happening. And that's what labor support is all about. It's giving you your best chance of having a healthy baby, a natural as possible childbirth experience.
And that's what we're going to do, is show a lot of things that do that. So my experience has been I'm up close to 50 now births that I've been at that weren't related to me. And the process of that, of showing partners what to do and having, being able to help with contractions, the more relaxed you can be and the more you allow your body to do what it needs to do, less interventions. And again, we talk about the doctors. If you don't have that support, a lot of times they'll push doing Pitocin. Let's speed things up. Let's get that baby out. Mm-hmm. And if things aren't going well, let's do an epidural, and we'll just, there's all these other things they can do. With having a professional labor support, it's more experience. This is your first time. It's not my first time. So
nice.
So the idea is to do the things that are going to help you and to coach you and support you. Me being there, and I always laugh at this, I always tell the husbands, don't give her your hand. I remember the first time I gave a pregnant woman in labor contractions my hand, I didn't think I'd ever work again. They are so much stronger than you think. Oh my God. But it's being there and breathing with you. I remember one of the very first ones I did with a friend, they had gone through Lamaze, like a lot. That's not something that happens anymore, where you're not taught a lot of the breath things. You're just told this is what you're going to do. And a lot of the nurses are really good and will help you through that. They come in and out. They have other patients. So having someone there all the time can be very supportive, or at least learning the things and sharing with your partners or your other family on what to do can be helpful. The more relaxed and calm you are, the easier it is to have the baby. Did you want to say something?
I was just going to say, I think you're going to illustrate and demonstrate and do some work. I'm going to step out of the way so you guys can get on with
Okay, you can leave.
Illustrating.
Okay.
Thanks for your attention, you all.